So actually, our front desk team will look up some specific details about the parents' plan themselves. Once they have that information, they can look up all the specific details about the parents' Delta Dental plan because it is different for each employer. Not all Delta Dentals are the same. So some patients actually will have, coverage normally just twice a year, but we have some parents who have unlimited cleans per year, and those patients can get their teeth cleaned whenever they want. So every plan is different. We look up the specifics about each child's insurance so that the patient and the parent can maximize their insurance benefits in their time. So we try to look up the patient's benefits ahead of time through their online system. After that, we input all of that information into our computer and we do our best prediction based off of the information directly from the individual plan to predict the out-of-pocket cost for the patient. So it's pretty accurate. There are some minor, changes that could happen, on the insurance side, but those are rare and unlikely. Another thing a parent could do if they want, the most accurate information is to also ask for a pre-authorization. It takes a few weeks to do that. In a lot of cases, it's not necessary, but if a child has extensive treatment and a parent really wants to plan ahead of time, they can request that. It takes a few weeks back, and you'll get a paper that shows exactly what the insurance is estimated to cover. One thing parents can do to help themselves during dental appointments, and remember, every insurance plan is different, is to understand and know their own benefits. Sometimes dental insurance plans will cover cleanings twice a year. Sometimes certain plans will cover things from a certain month to a certain month. So that's a different benefit period. But understanding that information of when your insurance is active, what your plan limitations are. For instance, how many cleanings do you get a year? How many x-rays are they allowing per year? How many fluoride treatments they're allowing per year will give you a better idea about what your out-of-pocket costs will be if you have any when you come for your appointments. So, if a patient does have Delta Dental, but they want to use our new patient special instead, it may be because they have Delta Dental HMO or they've already maximized out their benefits for the year and they want one last appointment. In that case, you can definitely use our new patient exam special, and that should cover almost everything for initial appointment and consultation. So, if a child has a toothache and a parent has completely exhausted their dental benefits already, we still offer discounted rates that will allow the parent to come in for a full consultation. And we have specific fees that we have for patients that do not have any insurance benefits on board. So, we do cash discounts and try to help parents as much as we can, especially in those emergency scenarios where you need to just get something done. I would say one really important information to know about your child's Delta Dental benefits is to know, when does your plan year actually start? And are you allowed to have cleanings once every 6 months, or is it twice anytime within the year? If it's once every 6 months, then you actually have to be scheduled 6 months and 1 day for the insurance to cover it. If you're 1 day off, sometimes they'll deny that. So that's my little tip for parents is figure out that information and make sure you're scheduled at least 6 months and 1 day after your first checkup.